Hello again. Now I will be talking about treatment of sciatica. So we already know that we have true sciatica and we have piriformis muscle syndrome, which is fake sciatica. So let's start first from treatment for sciatica, for true sciatica. Compression on sciatic nerve is due to misalignment of the spine. I was really lucky that I found ABC correction, advanced biostructural correction, because this is a very effective treatment for example, sciatica, which always I link, because in examination it's confirmed that is connected with misalignment in the body. So after examination, after I know that I am dealing with true sciatica, I check spine, I know all in observation misalignment, and then I need to find out which side of the body is the site of compensation, and which side of the body is pathological, which requires treatment. So I do a sit test. The client is supposed to sit. From standing just goes to sitting on a chair with flat seat, and then I'm using this board. A client is sitting, and then I know which side is compensation, which side is pathological. So the movement of pelvis towards to which side pelvis goes down tells me if it's right or if it's left. So then I have client standing and I check each single vertebra starting from C7. I'm going down, and if any is out of place on this breakdown side, so on the side which is pathological and not just compensation, I do correction, and I do correction on a bed or against the wall. It all depends on the level of misalignment where the correction is done. So if it's lower back from L3 and legs and chest, so I do on a bed. If it's higher up, so this is against the wall. Usually to reduce pain of sciatica, it requires between 2 and 6 adjustments. All depends how long has it lasts. We know that if a reaction of the client, so treatment is provided quicker, so the time of treatment is reduced. If it's, for example, third or fourth or fifth episode of sciatica, so we know that it's chronic, and the body, probably the shape of the spine looks not really very good, and we need to undo a lot of things. And it might be compensation of compensation, compensation of compensation. So this is process. But usually it's 2-3 months, and it's huge, massive difference in someone's life and someone's function and life quality. So I had many situations that it was 1-2 adjustment and it was massive difference, especially in function. But of course, ideally it should be the process. Same like if you go for treatment of your teeth in orthodontic clinic, for example. So what else I do for sciatica? For sciatica, usually here you have very tight muscles, and also you might have piriformis muscle tight. So here is very good application where I put 2 needles in specific spots, extra leg point, acupoint, and from gallbladder. So we have 2 needles here. About I'm explaining like very briefly, but of course this is very specific place. You just measure exactly when where the needle should be inserted, and here from bladder meridian on 3 levels, so bladder 24, 23, 24, 26 bilaterally works really very well. And after this acupuncture, immediately this lower back area is relaxed. And what else? Of course, massage is good to reduce tightness in muscles. And also what is very, very, very important, and for me this is always number 1, is prevention. So what to do to support treatment and to avoid any other episode is just good sitting, good standing, and good sleeping. So you can watch videos which are on the channel about sitting, standing, and sleeping. I'm not sure if it's there already, but anyway, what's about is about sitting. This is the rule that you need to have hips above knees. If you cannot achieve this pattern, because for example in a car your seat is too low, so you can always put something like this, a seat wedge, and you will compensate this difference. So it will increase your height and will change position of your femur, your hip. Another thing is that when you sleep, ideally on back or on side, you should support your spine, so it shouldn't be like in a space, so it should be actually supported. So it's really not good when you're sleeping for like 7-8 hours without support for your body. So when you sleep on side, so we see that to have a head in neutral position, you need to have a bit higher, bigger pillow to avoid lateral flexion or flexion forward. When you sleep on your back, also you need some pillow. So if it's too flat, also it's not good for the body, for meninges, for posterior meninges, for example, which is very well treated, and it's very important in protocol of ABC, Advanced Biostructural Correction. Thing that I didn't show you the tools. So this is tools which I use. It's very simple. Just glove, which is protection for my hands, and this, which might be even replaced with a book. So we have this height or this height. So it's enough to have 2 different height of books, and you can treat wherever. If you don't have this, I, for example, in extreme situation, use just my finger to push, for example, on a femur bone posteriorly or anteriorly if it's needed. Yes, so for example, one extreme situation. It was during cycling when we cycled in Poland with my friend Gosia, who's by the way in rescue team, Wałbrzyskie Pogotowie Górskie. She had problem with her neck and head after bumps during cycling. So we cycle single tracks somewhere in Bardo, I think in Poland it was. I don't remember exactly, but anyway, I didn't have tools obviously with me, but I had my hands and knowledge how to do this. We found just a building. It was just on the way, the end of the track, and just I managed to fix her first rib and C7 using just my fist and my hand. And this is just digression. We just talk about sciatica, but the spine, cervical spine, also affects your lumbar spine. So just to avoid sciatica, you just need to holistically look after your whole spine. Thank you for watching.